flesh your fingers and try to get me in it too.
Gotcha.
All right. So, remind me now, when was surgery?
September 10th.
September 10th, and right now it's November 29? Okay. So, the kneecap's moving great. And the whole idea for Jeff behind the camera, for me to assess patellar mobility, the leg has to be relatively straight, the heel propped somewhere. If the knee is bent at all, and so like you have full range of motion, you have 0 degrees of extension, that's perfect. If the knee was flexed a little bit, the kneecap's not going to want to move, right? So as the knee drops into extension, what happens is the kneecap is actually just a bone that floats inside the tendon. So your quadricep muscles, your 4 thigh muscles come together, they create a tendon that comes down and attaches into the tibia. That bone just floats in the middle of that, and that's exactly what we want. We want a little bit of mobility side to side. We want a little bit of mobility up and down. What people don't realize is as the knee flexes, so let's flex it, that kneecap actually drops down, and it also shifts to the side a little bit. It kind of goes through this zigzag pattern. Let's put it back up here one more time. So Jeff, as a therapist, what we want to do is we want to just make sure the kneecap's floating nice. If there's a bunch of swelling, which there's not hardly any, there's going to be a little bit of kind of space under the kneecap. We'll call this like a patellar tap. So some people that have knee replacements, their kneecap, right there, can you feel that? So their kneecap will actually tap against the prosthesis underneath. It's not a bad thing. It's a normal sensation. That tapping is good. You had 125 degrees of flexion today because you have good mobility through the joint. And so that's part of assessing that mobility. We measure flexion, we measure extension, we make sure the kneecap is mobile side to side, up and down. And really, I mean, that's it. Now the incision is mostly gone. You can barely see that it's still there. Another thing that I always like to remind patients is early on, once the incision is closed, not just to you do your patella glides side to side, you do 10 of them, and then you do up and down for 10. But then you can also just do a little bit of cross fiber on the incision. This just allows you, like you've got a little bit right there still, but I can't feel anything, you know? So that's great, that's perfect. I couldn't ask for a better knee recovery, even though it's not my knee recovery. But that's it. So assessing patellar glides, side to side, up and down, maybe a little bit of a tapping sensation when I push straight down on it, and we're done. Thanks. Okay. Let's do the balance game.